Countries in East Africa face a lot of challenges in terms of maternal and child health. If you look at the indicators, maternal mortality, under 5 or child mortality, they are not very good. They compare less favorably with other regions of the world.
It's primarily because more women who shouldn't die are dying because of either lack of access to health facilities, or when they do access health facilities, they do not have, they don't get quality care.
Another challenge is about the infrastructure. The infrastructure for health is not so strong. Actually, Eastern African countries have very strong policies, very good strategies, but when it comes to implementation, it is very, very weak.
The purpose of this institution, called the Hpro, is to basically support researchers and the evidence that they have or they generate to reach certain decision makers. And this could be at national level, could be at sub-regional level, and could be at regional level. The Hpro model, or the context around the Hpro, I'll give it in 3 ways. One, there's capacity strengthening. The second thing is we help connect these researchers with decision makers. The third thing is to be a liaison, or a knowledge broker, if you like. So we appreciate that they may not necessarily have the time to meet the right decision maker.
The health policy and research organizations do have forums which bring together researchers and policymakers. We have a forum that brings together health ministers. And we think that this is a perfect forum which can facilitate knowledge uptake.
So at any given time, all the projects within a country know what each person is doing. They're able to learn from each other. And that's really because we're working as teams together in a country. And that's the strategic approach.
The objectives of Hpro is around evidence generation. The second objective is around integration of evidence in policies. And the third objective is around collaboration and partnerships with the decision makers.
The fact that the researchers are now looking at how can we get this evidence to decision makers and which decision makers. We've gone through processes, we've mapped out stakeholders, we've mapped out the policies that exist in a country. We have looked at and outlined like what processes do we need to go through in each country. And as a result of this, we've built relationships, and the researchers now know who needs what evidence and what is important to them. And they even now know how can they get it to them. So does that mean they need to do a policy brief? They know how to do a policy brief. For example, in Tanzania, where the Permanent Secretary for Health has been very, very instrumental in informing some of the health practices that are happening in Tanzania. And I think that's a huge success to have a senior government official appreciate the value of evidence in informing his or her decision or the decision of our ministry in terms of issues to do with maternal and child health.
The other success that I'm talking about here is capacity building. As the initiative got implemented, we are strengthening the capacity of researchers in Africa to be able to identify problems and conduct research to generate evidence that will help address those problems.
Hpro, they are the ones who did a lot of mentorship for us. They taught us on how to do qualitative methods, systematic reviews, writing for publication.
And therefore, Hpro comes in handy to create forums, to create space for such evidence that has been generated to be disseminated for potential uptake and ownership.